Hi, my name is Erica Armstrong, and I'm a student physical therapist assistant at Jeff State. Today, we will be going over the disease, acute lymphocytic leukemia. We will be discussing the mechanism of the disease, signs and symptoms and diagnostic procedures, groups that are affected in their prognosis, common medical treatment options, physical impairment, functional limitations and their disabilities, PT interventions along with precautions and contraindications for physical therapy, and the practice pattern that goes along with this disease. Acute lymphocytic leukemia, also known as acute lymphoblastic leukemia, is the most common form of cancer in children. It is a cancer of the blood and bone marrow that progresses rapidly through the body and can be considered deadly if not treated. The mechanism of the disease is that ALL is caused by errors in a bone marrow cell that develops in the DNA of a person. This cell continues to divide and grow, unlike normal cells that stop growing, causing blood production to be abnormal. This is depicted in the picture to the right, where white blood cells have been overtaken. The marrow then begins to produce cells that are immature, which then develop into leukemic white blood cells known as lymphoblasts, which is where acute lymphoblastic leukemia gets its name. No one is clearly certain on what causes this mutation, but doctors have determined through multiple tests that it is not inherited through family members. ALL can spread quickly through the body, affecting the central nervous system, lymph nodes, liver, spleen, and testicles, causing them to shut down rapidly. Signs and symptoms of ALL can mimic those of the flu. Fever is the first major symptom, along with frequent infections. Seek immediate medical attention if there is a constant fever and a persistent infection, because this could be the beginning stage of ALL. Other signs and symptoms include bone and joint pains, frequent and severe nosebleeds, lumps caused by swollen lymph nodes in and around the neck, underarm, abdomen, or groin, paleness of skin, shortness of breath, weakness and fatigue or a general decrease in energy, night sweats, pain or feeling of fullness below the ribs, pinpoint red spots on the skin, and loss of appetite and weight loss. Diagnostic procedures include blood tests, bone marrow aspiration, which is depicted to the right, biopsy lumbar puncture, X-rays, ultrasounds, and computerized tomography. Computerized tomography is a technology that uses computer-processed X-rays to produce tomographic images of specific areas of the scanned object, allowing the user to see what is inside the body without cutting it open. I have attached a link to describe what a computerized tomography really is. If you have any questions, let me know. Groups that are affected are children that are from the ages of 3 to 7. Adults may also be affected in later years due to weaker immune systems, but over 80 to 90% of those adults will quickly enter remission after treatments. Children have more of a chance of going into remission within a couple of months of diagnosis as compared to adults, because adults have weaker immune systems and have a hard time fighting off the infection. Statistics show that once a person has gone into remission, over half of those people will have the cancer return in later years. The prognosis for children with ALL is good. The overall cure rate for ALL is around 40%, but as was stated in the previous slide, there is over half a chance that the cancer will return. Cure rates tend to be higher in children rather than adults. But ALL is fatal, but with the right treatments, a person can be cured. Common medical treatments include induction therapy, consolidation therapy, maintenance therapy, preventive treatment to the spinal cord, chemotherapy, targeted drug therapy, radiation therapy, stem cell transplant, and clinical trials. The picture to the right depicts a stem cell donor that is donating stem cells to the hospital for medical treatment. 38% of children receiving treatment for ALL develop osteonecrosis, often without any symptoms. This can occur in a 2-month to 5-year span from diagnosis of ALL. Osteonecrosis occurs in bones where blood flow has been reduced. The lack of blood flow causes the bone to break down faster, which causes severe pain and decreased range of motion. Physical impairments of people with ALL are fatigue, decreased stamina, decreased strength, decreased range of motion, pain, increased bleeding, shortness of breath, changes in gait, and decreased weight. Functional limitations include difficulty walking, difficulty playing for children because of the pain in their joints, difficulty with movement, and also difficulty with ADLs. People with ALL can become disabled if the cancer spreads to the organs and begins to cause them to shut down. This can cause the patient to rely on machines to help their organs function, or also a wheelchair to help them with ADLs, and also rely on other people to help them live. They also may have to have dialysis for their kidneys if their kidneys begin to shut down, or also they may even have an organ removed because it has become affected by the ALL. All of these physical impairments and functional limitations in some way have to do with the treatment that the patient is receiving. The treatments cause fatigue and shortness of breath, and also can cause a decrease in strength and stamina because the body is having to fight the infection that is occurring in the body. Physical therapy interventions include modalities such as cryotherapy and thermotherapy to decrease pain and inflammation to the joints, strength training, energy conservation training, stability exercises, gait training, range of motion activities, and patient education on safety with ADLs. Precautions that a PT should be aware of are vital signs, extreme fatigue during exercises, extreme pain during exercises, and also the susceptibility to skin tears due to the weak integumentary system, shortness of breath, and also be aware of the white blood cell count. If their white blood cell count is low, then precautions must be taken so that they do not exacerbate their symptoms and become sick. Contraindications for PT include the phonophoresis with dexamethasone because it is also known to cause osteonecrosis in people. It causes more of a breakdown of the bone, causing even more pain to the patient. Also, E-stim and ultrasound are contraindicated for patients with any form of cancer. Special implications that a PT or PTA should be aware of are that all patients with ALL are susceptible to osteonecrosis. So you have to be aware of the signs and symptoms of osteonecrosis, and also be aware of their chart. If it says they have osteonecrosis, then you have to be able to change your activities or modify the weight bearing or modify the exercises for the day. Practice patterns for ALL are 4C, 4D, 5E, and 6B. The musculoskeletal system is affected because of the treatments causing fatigue and weakness. Bone and joint pain along with osteonecrosis places ALL as an unspecified disorder of the joints. The neuromuscular system is involved because ALL is a progressive disease that can affect endurance and motor function if it has spread to the central nervous system. It also has an effect on aerobic conditioning of the patient due to fatigue and increased workload on the body to fight infection. In conclusion, acute lymphocytic leukemia is a progressive form of cancer that affects children and some adults. It is deadly if not treated, but there are many different forms of treatments that are used to treat ALL that we discussed today. Therapists have a very important job of helping their patients regain strength and confidence once the treatments have ended, but safety is a main component of the patient's physical therapy treatment so that they can return to their ADLs and their life safely. Early detection of ALL is essential so that the body is not completely affected and so that it can be treated without long-lasting effects to the body of the patient. Thank you so much for listening. If you have any questions, please just let me know, and have a blessed day.